Hello, good evening all. My name is Nikita Pune and today we are going to discuss about the metformin drug. In that video we are going to discuss about the metformin, the mode of action of metformin, the adverse effect of metformin, uses of metformin and action of metformin drug. Firstly, the basic introduction of metformin drug. Metformin is an antibiotic drug. It belongs to bioquinide class. It belongs to bioquinide class. It is the only drug available in this class because previously the metformin and fenformin, these two drugs are released in a market. After the post marketing surveillance, the more adverse events are observed in a fenformin drug. The various type of serious adverse event that like life threatening, death and the prolonged hospitalization, these types of adverse event and get noticed by the metformin drug. Therefore, the metformin drug get banned and discarded from the market. And the metformin drug is get continued because of the metformin drug has the less side adverse effect, and the effect is more as compared to the fenformin drug. The metformin drug has it does not shows the hypoglycemia because it does not increase the serum insulin level. It activates the enzyme AMP, dependent protein kinase. After that, the mode of action of mode of action of metformin, that is the made after the consumption of administration of metformin drug, it stimulates the AMP kinase enzyme. Due to that, it orders the liver to decrease the glucose production. Means when we administer the metformin drug, it started to stimulate the AMP kinase enzyme, and that AMP kinase enzyme gives the stimulants to the liver to reduce the production of glucose by inhibiting the glycogenesis and glycolysis. After that, it also increase the glucose utilization. Means the glucose utilization is increases after the administration of the metformin drug. After that, decrease intestinal absorption of glucose. Means it decreases the amount of glucose absorbed by the intestine. It helps to decrease the level of glucose in blood. After that, the decrease of gastric emptying and a reduce of appetite, which is responsible for the weight loss in a person. After that, it inhibit the lipogenesis and increase the fatty acid oxidation. It increases the fatty acid oxidation and inhibits the lipogenesis. It also shows after the consumption of metformin drug, it also shows the anti-aging effect. It is a primary action of metformin is a after the metformin administration of metformin drug, AMPK is get stimulated and it goes towards the liver and send the signals of liver to start the gluconeogenesis and decrease the level of glucose in the blood. For that, it decreases the blood sugar level and controls that. The other actions of metformins are they are increased glucose uptakes. After that, increase the fatty acid oxidation, increase the insulin sensitivity, decrease the intestinal glucose absorption. that are the basic actions of the drug. Metformin do not cause the release of insulin from the pancreas. Metformin is a more effective drug as compared to other. It is a more and a diabetic drug and more effective due to the as compared to the other drug, because it does not cause the release of insulin from the pancreas. It does means after many drugs are available in market of anti-diabetic drugs are available in the market, but some drugs are after the administration of that particular drug is after administration of that particular drug, it started to stimulate the pancreas, and after that the pancreas started to uh, release the insulin to maintain the glucose level in the blood. The and that metformin drug does not detect the pancreas or order the pancreas to stimulate the insulin. After that, the adverse effect of a drug. After that, some every drug has a side effect or the adverse effect, but when the drug does not cause a serious adverse effect and shows the more therapeutic effect, that drug is normal. The adverse effect and side effects of the metformin drugs are the metallic taste in mouth, abdominal pain, nausea, vomiting, diarrhea, and lactic acidosis. Means metallic taste occurs in the mouth. After that, the stomach pain, abdominal pain, nausea, vomiting, loose motion, diarrhea. These are the common adverse effect of the metformin drug. There are also various uses of metformin drug. Metformin drug is also used to treat the prophylaxis of diabetes 2 diabetes type 2 diabetes mellitus. The in that type 2 diabetes mellitus, the metformin is given in a combination therapy. Means the single dose of metformin is not given, is always given in a combination, means two drugs combinations. After that, it also used to polycystic ovarian disease, PCOD. This disease is occurs in females. To treat the polysaccharide ovarian disease, the metformin drug is also prescribed by the physician. After that, decrease the microvascular as well as microvascular complication. This is another use of a metformin drug. Metformin is a common drug which is used for the anti-diabetic reaction. It helps to decrease the level of sugar in the blood. It decrease the level of glucose in the blood. After the consumption of metformin drug, it goes to it start metabolize into and break down and dissolve. It started to metabolize. After that, it stimulates the APMK enzymes, kinase enzyme, which is give the order to the pancreas to stop or decrease the stimulation of glucose. Due to that, the glucose level is decreases, and the sugar level in the blood is becomes in a control. It get controlled by the and it also stimulate the glycolysis. That means the increase the glucose utilization. uptake the glucose, take up glucose, decrease the intestinal absorption of the glucose, decrease the insulin resistance, after decrease the gastric emptying, after it is a biaquinite drug class. No hypoglycemia because does not increase the serum insulin level. AMPK full form is activated protein kinase. That is a common mechanism of a metformin drug. In that video, we studied the mechanism of metformin drug, adverse reaction of metformin drug, uses of metformin drug, and mode of action of metformin drug after the primary action of metformin drug and the other actions of metformin drug. These are the these mostly topic we are covered in that video. Thank you so much.